Chapter 10. By the end of this chapter, students will be able to
understand health disparities and the impact on substance use, analyze how external factors influence behavior, and identify risk factors that impact health outcomes. Scope of the problem. Today's topic is going to focus on health disparities, primarily with a focus on substance use disorder. Of the individuals in the US diagnosed with substance use disorder, only 11% received treatment. Encourage students to share their ideas of what could be some reasons as to why so few people living with substance use disorder receive treatment. What are health disparities? Health disparities are differences in health and healthcare between groups of people. These differences can be linked to social, economic, or environmental disadvantages. Put more simply, health disparities are when one group of people experience a health condition at a greater rate than the general population. As it relates to the opioid epidemic, there are a multitude of communities that have been disproportionately impacted. Here are some of the communities impacted at greater rates by the opioid epidemic. What are social determinants of health? Because health disparities exist at the communal level, we must look towards the different conditions within our communities to better understand the root causes. Social determinants of health are the conditions in which people live, work, learn, and play. While adverse childhood experiences focus on how trauma on the individual can impact someone's risk for substance misuse, social determinants of health focus on the systemic causes for potential trauma or stressors that would serve as risk factors throughout their development. Social determinants of health can contribute to health inequities and result in intergenerational risk for substance use and overdose. Turn and talk. Encourage students to turn and talk with the person next to you. What is another example of a health disparity? What is intersectionality? Intersectionality looks at how different aspects of a person's identity contribute to the oppression and/or privilege they experience. People may be treated differently by healthcare workers and professionals, employers, neighbors, or family based on an illness in addition to their socioeconomic status, racial identity, or identification with another marginalized group. These intersecting identities could lead to stereotyping, judging, devaluation, and discrimination of the patient and their lived experience. At this time, there's a short video on intersectionalities in the PowerPoint that you can choose to show and further explain what intersectionalities are. Intersectionality and substance use disorder. Substance use disorders often occur at higher rates in relation to other stigmatized characteristics, such as lower socioeconomic status, employment status, criminal record, race, gender, or sexual orientation. When discussing substance use, isolating each of these conditions fails to address stigma and undermines the complexity of trauma caused by injustice and discrimination in our society. Equity. Equality and equity are two terms often used interchangeably, though they mean two very different things. Use the image provided to help students visualize the difference between equality, equity, and justice. Equality in this instance is everyone receiving the same size box to see over the fence. Equity is everyone receiving the appropriate size and number of boxes to see over the fence. Justice is the removal of the wooden fence and it being replaced with a chain link fence so that everyone, regardless of height, is able to see the game without any additional support.
What communities are disproportionately impacted? Please note that we are highlighting specifically substance use inequalities amongst these populations. Asian American and Pacific Islander. The model minority stereotype is the cultural expectation placed on Asian American and Pacific Islanders, or AAPI, that each individual will be academically successful, wealthy, hardworking, living the American dream, submissive, spiritually enlightened, and/or never in need of assistance. Due to this stereotype, there is a lack of data about the AAPI community and a deep misunderstanding of how substance use disorders manifest within the community. This misunderstanding has led to many cultural, individual, and practical barriers to treatment. Discussing mental health concerns, including substance misuse, is considered taboo in many Asian cultures. AAPI are more likely to seek help and support from personal networks, such as close family friends, family, and religious communities before consulting with professionals about their substance use disorder. Black communities. According to the U.S. Centers for Disease Control and Prevention, the largest percentage increase in drug overdose deaths in recent years has been within the Black community, more specifically with older Black men. There were 54 fatal overdoses for every 100,000 Black men in the United States, compared to 44 for white men. This history of being overrepresented in experiencing criminal consequences related to substances has helped shape different cultural sensitivities and fears surrounding substance use disorders. Black communities may be more predisposed to mistrust government-led programs aimed at addressing substance use and may be more reluctant to reach out for treatment because of social stigma. The focus on punishment rather than treatment has been disastrous, traumatic, and dehumanizing, especially to Black people. This has perpetuated generational traumas such as higher incarceration rates and unemployment due to incarceration history, family separation, financial hardships, and lack of access to equitable treatment and prevention resources. Latinx communities. According to the 2021 National Survey on Drug Use and Health, 16% of Hispanic and Latinx Americans were diagnosed with a substance use disorder. Nearly 22% of Hispanic and Latinx Americans reported having a mental illness and are less likely to be connected to treatment for it. Hispanic and Latinx Americans experience barriers to behavioral health services and care, including racism, discrimination, stigma, language barriers, and cultural beliefs. Indigenous communities. Indigenous people are more likely to report substance misuse than any other ethnic group. Nearly 1 in 5 Indigenous young adults have a substance use disorder. Approximately 4 in 10 Indigenous adolescents have a lifetime history of illicit drug use. Lack of awareness about mental health issues and services that are available, and a lack of programs and providers that are sensitive to Indigenous cultures can prevent Indigenous people from receiving treatment. Access to mental health services is severely limited by the rural, isolated location of many Indigenous communities. Additionally, access is limited because most clinics and hospitals of the Indian Health Service, which provides healthcare to Indigenous communities, are located on reservations. Yet the majority of Indigenous people living in America live outside of tribal states. Veterans. Mental illness and substance use are relatively common among military veterans. Marijuana and psychotherapeutic drugs are the most commonly misused by veterans. More than 500,000 veterans misuse prescription pain relievers. Veterans may self-medicate with substances to improve sleep quality, but substances change the quality of sleep and make people feel less refreshed. Veterans may use substances to cope with feelings of depression or irritability, but all of these feelings can worsen when using substances. People living with disabilities. For the purpose of this training video, disabilities refers to those with physical, developmental, intellectual impairments, as well as the deaf, hard of hearing, and blind communities. For a more in-depth understanding of how these specific communities are impacted by health disparities, please refer to the Curriculum Guidebook. In the United States, 54 million people experience some form of a disability. Of that number, roughly 9%, a total of 4.7 million adults, have both a substance use disorder and a coexisting disability. People with physical disabilities experience substance use disorder at 2 to 4 times the rate of the general population. The isolation that is experienced by people with disabilities leads many to seek a false sense of comfort with harmful substances. Barriers to engagement in substance use disorder treatment for people with physical or cognitive disabilities may be social, environmental, economic, or psychological. Other barriers relate to treatment facilities. Examples include inaccessible parking, inaccessible entrances, organizational barriers such as a requirement that clients be able to evacuate a facility unassisted in an emergency, limited or no materials in Braille, or other alternative formats for people who are blind or visually impaired. LGBTQ+ community. Statistics show that LGBTQ+ adults are more than twice as likely as their heterosexual counterparts to use illicit substances and almost twice as likely to suffer from a substance use disorder. 6.3 million LGBTQ+ adults have substance use or mental health disorder or both. LGBTQ+ teens are twice as likely to be bullied, excluded, or assaulted at school. They're nearly 40% less likely to have an adult in their family to whom that they can turn to. They are twice as likely to experiment with drugs and alcohol. These factors contribute to the prevalence of substance misuse in the LGBTQ+ community. Discrimination and social stigma, lack of support, fear of coming out, potential lack of parental support, internalized homophobia, co-occurring disorders, lack of cultural competency in the healthcare system, socialization, and marketing. Women. Only 20% of individuals in substance use disorder treatment are women. Women are more likely to use substances with an intimate partner, whereas men are more likely to use substances with other male friends. 32.1 million women in the United States have a mental health or substance use disorder. The participation by women in the drug trade is predominantly affected by socioeconomic vulnerability, trafficking, violence, intimate relationships, and economic associations. Exit ticket. 2 truths and a lie. People can fit into multiple minority groups. Equality and equity are the same thing. Social determinants of health contribute to health inequalities.